useless. And those who recover from heart attack, they must feel that now they have a chance to lead a very, very healthy life if they follow certain rules and if they follow the modern treatment. Treatment has improved considerably. Treatment has improved considerably since I started practice. And it has become very effective. And now, even the people, I normally don't go by slides, This is the first time that somebody forced me to do that, so I did it. But I just come to this last thing, that, this is very important. Okay, there is a well-documented evidence called oculostenotic reflex. Now, let me tell you, this particular slide was made by Ramesh.I.Kapadia. When he saw all my things, he said that, Samir said that, Daddy, you must tell this to the audience. Okay, there is a well-described phenomena called oculostenotic reflex, where a mere stenosis without symptoms or clear indication for treatment, mere stenosis. I know in this hall, I can't name them, a doctor and doctor's friend. You can let me just find out. I run on the treadmill, I'm all right for 12 minutes, 13 minutes, I get something. Let us check you up. And he checks him up, and he said, oh, little change. Can we do your angiogram? Why angiogram? I'm a friend, let me do. Angiogram, he does it. And he finds, oh, I've got a little obstruction there. Let me do the angioplasty, he said. And he did the angioplasty. Such things, see, there is a well-described phenomenon called oculostenotic reflex, where mere stenosis without symptoms or clear indication of treatment ends up with stent or surgery because doctors and patients cannot reconcile with the fact that all stenosis do not require treatment. You cannot reconcile with the fact that all stenosis do not require treatment. And I believe that stenosis has got to be evaluated with so many things. 100% stenosis can be quite safe. There is no need that 100% you are sitting on a bomb. That's all wrong. And for a large number of patients, and this is another point he said, Samir wrote it. For a large number of patients undergoing bypass surgery, there is no evidence, remember that, there is no evidence that it improves their survival compared to those managed by medical means. Yes, bypass surgery only improves survival in patients with the left main artery disease or three-vessel disease with impaired left ventricular function. If there is impaired if the ejection fraction is reduced, then it's a three-vessel disease, just like my brother had, and therefore I took him for bypass surgery, and he was operated by Denton Cooley. So he had 15 years of active life, but then he died. But 15 years of active life, he would not have if he were only on medical treatment. He was a shining example where bypass surgery was needed and bypass surgery helped him because his ejection fraction had come down to 30, which after surgery came to 45. Now, any person who gets the heart attack, and once the ejection fraction comes around about 45, he should consider himself cured. 45 or 50 ejection fraction, that is normal. 60% is 100%. It's not 60, it's not 160. That is, 60 is not of 100. 60 is 100%. Newborn baby has 60%. So therefore, once you have a 45% ejection fraction, that means your heart is now normal. So such people do not benefit by bypass surgery. It does not offer a benefit of survival when the left ventricular function is good. Now, another point, which is very, very important. Patients with stable angina have very low annual mortality of approximately 1%. So many people have stable angina. Only when they walk very fast, or when they get very angry, or when they walk after a meal, then they get a little pain. Otherwise, they are all right. Which is not that the mortality, annual mortality in them is not significantly higher than that of the general population. It's not significantly higher than the general population. When the plaque, why does that? Because when the plaque grows in the wall of the artery, coronary arteries are capable of remodeling themselves and enlarging at the site of obstruction. And this is what Hippocrates, the father of medicine, said. And that he said that the body has a natural capacity to heal. And he said to the doctors that your job is not to heal, but to encourage that natural healing process. Doctor's job is to encourage that normal healing process, which we inadvertently now, with all our modern approach, we do just the negative. We don't encourage that normal healing, but we discourage it totally. When a person approaches the doctor now with a little chest pain and a treadmill positive, we say, you get the angiogram done. Now angiogram is rarely done for diagnosis. We have got other methods of diagnosis. Now it is done only when a responsible and a senior doctor thinks that he requires angioplasty or bypass surgery, then and then angiography is done. I do not want to go on like this, but let me tell you something else. That the patients with advanced coronary heart disease, especially those who are considered technically unfit for surgical intervention, are also benefited by intensive medical management, lifestyle changes, and in-depth stress management. They have also a hope in the in-depth stress management, and therefore I have added universal healing program to the normal regime of medical treatment. And there are the last thing is there are large number of patients who cannot afford surgery. And they also now have a ray of hope in successful management of their problem. And this involves the patient's participation in the in-depth stress management along with intensive medical management. I tell you very honestly, I tell you with all the confidence that the future of coronary heart disease, if properly understood, is very, 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 very bright. The people think it is grim, but I think, and Dr. Panda, who inaugurated my Gujarati book, and he was interviewed on the Doordarshan, the last question was asked to him, what is the future of this disease? Last question was asked to him. And he replied in Hindi, and he said, I don't know. But he said, when I started my practice, I had certain number of bypass surgeries done. And now my number now of bypass surgery is reduced by about 40% because of the increase in the understanding of the disease and the new medications and the other stress management, all that. So therefore, most people who have got a normal ejection fraction and who are stable do not really require it. And then fellow said, but what is the future? He said, I don't know. The future may be that more and more research comes in, more and more understanding comes in, the bypass surgery may go down in history. That's what a surgeon of eminence, who has got an Asian Heart Institute of Delhi, that's what he said. So with that note of confidence, and let me give you a nice big hug, all of you, for coming here, and thank you.
આભાર રમેશભાઈ. આ કાર્યક્રમમાં પુસ્તકનું વિમોચન માટે આપણે શિકાગો ઓનલાઈન થવાના છીએ, તો એનો સમય આપણે ત્યાં સાથે 6 વાગ્યાનો આપ્યો છે. એ પહેલાં હું મિસ્ટર ગુપ્તા ફ્રોમ ધ યુનિવર્સલ હિલિંગ ડૉક્ટર રમેશભાઈનું ફૂલોથી સ્વાગત કરવા ઈચ્છે છે, તો મિસ્ટર ગુપ્તા પ્લીઝ બુકેથી એમનું સ્વાગત કરશે. છ વાગવાને હજી 10 મિનિટની વાર છે, તો આપને માટે એટલું જ કહેવાયું કે મન જ્યારે જાણે ત્યારે એને જ્ઞાન કહેવાય, હૃદય જ્યારે જાણે ત્યારે એને પ્રેમ કહેવાય, અને જ્યારે અસ્તિત્વ જાણે ત્યારે એને આપણે ધ્યાન કહેવાય. આજે આપણા ઉપસ્થિત મહેમાનોનું સ્વાગત કરવા મેમેન્ટો આપીને સ્વાગત કરીશું. મેમેન્ટો માટે ડૉક્ટર રમેશભાઈ કાપડિયા, આપને વિનંતી કે આપણા અતિથિ વિશેષ તરીકે પધારેલા ડૉક્ટર મનચંદાજીનું સ્વાગત બુકે મેમેન્ટોથી સ્વાગત કરીશું. નવજીવન ટ્રસ્ટના વિવેકભાઈને આગળ આવવા માટે વિનંતી. Dr. Sain Pitroda, you are not here, but we have kept one gift for you, and this is a memento from Dr. Kapadia. આ આ કાર્યક્રમ પૂર્ણ થવા આવી રહ્યો છે ત્યારે આપણે એટલું જ કહીએ કે મનુષ્ય સંકલ્પને વાવે છે અને કાર્યરૂપી ફળને લણે છે. કાર્યને વાવે છે અને ટેવરૂપી પાક મેળવે છે. એ ટેવને કેળવી એમાંથી ચારિત્ર્ય ઘડે છે. ચારિત્ર્ય પાકું બનાવે અમી એ પોતાનું ભાગ્યને ઘડે છે. અને ભાગ્યમાં જ્યારે પુરુષાર્થ ભાળે ત્યારે એ વ્યક્તિ મહાન બને છે. ડૉક્ટર રમેશ કાપડિયા તેમજ ઉપસ્થિત આપ સૌના અમે આભારી છીએ. અને આજના આ પ્રસંગે ઉપસ્થિત ડૉક્ટર મનચંદાજી જેઓ ખાસ દિલ્હીથી અત્રે પધાર્યા છે એમના અમે આભારી છે. ડૉક્ટર સેમ પિત્રોડાએ એમના અમૂલ્ય સમય ઓડિયો વિઝ્યુઅલ દ્વારા પુસ્તક વિમોચન માટે ફાળવ્યો, એમના પણ અમે ઋણી છીએ. મુરબ્બી શ્રી નારાયણભાઈ આપના પણ અમે આભારીએ છીએ આપ આ પ્રસંગે ઉપસ્થિત રહ્યા માટે. આજના આ કાર્યક્રમને સંપૂર્ણપણે સફળ બનાવવામાં જેમનો સાથ આપ્યો છે એવા સર્વે વ્યક્તિઓના અમે આભાર માનીએ છીએ. આપ સર્વજનો ઘણી મોટી સંખ્યામાં અહીંયા ઉપસ્થિત રહ્યા માટે આપ સર્વના પણ અમે ખૂબ જ આભારી છીએ. ફરી મળીશું. નમસ્કાર.